Dhesi, ladies and gentlemen. All right, usually it's customary for the moderator to introduce the panel, but no worries, I think time is of the essence. Our first panelist, please put your hands together for Mr. Leon Jackson, from Digital Transformation Lead from Roche Information Solutions, APAC. After you, sir. Next, we would like to invite to the panel the CEO of the Smile Klinik. Please welcome Dr. Firdaus Hanapiah. Next, we welcome the Senior Principal Assistant Director of Disease Control Division, MOH, Dr. Mahesh Appannan. And last but not least, we invite Executive Director of Pharmaceutical Association of Malaysia, Madam Chan Lee Jin. Please welcome. Dr. Dhesi, the panel is yours.
Thanks. Hi, everyone. Welcome to Digital Health, or how do we accelerate digital health opportunities in Malaysia. So basically, today we have esteemed speakers here, basically from the whole spectrum of healthcare, dentists, pharma association, doctors, and even software engineers here today. So basically, let me introduce, we'll start with Lee Jin first. So Lee Jin, over there on the left, Lee Jin is the Executive Director of Pharmaceutical Association of Malaysia, Pharma, and serves as an Executive Council member of Arthritis Foundation Malaysia, AFM, and also the advisor to the Psoriatic Coalition. She's a digital immigrant who only learned to use the computer at the age of 30. She witnessed the massive socio-economic transformation brought about by digitalization across various sectors in the last few decades. Health tech, however, only gained momentum during the COVID-19 pandemic and is set to grow further across the healthcare ecosystem with increased public acceptance. A strong proponent of purposeful living, she advocates for increased adoption of digitalization in the healthcare sector to enhance healthcare quality and delivery. Thank you, Legend. Welcome on board. My next panelist is Dr. Mahesh. I think everyone knows Dr. Mahesh. Dr. Mahesh is from the Ministry of Health. He's an avid advocate of digital health, data-driven strategies, and policy making. Being attached to the MOH, public health was an area of interest, focusing on evidence-based medicine using latest technology and artificial intelligence in healthcare sector. The latest task was to lead the digital health team for COVID-19 pandemic management in Malaysia. During this challenging time, the team developed a COVID-19 outbreak management system, a community empowerment mobile application, as you all know, My Sejahtera, strategic partnership with governmental and non-governmental agencies for big data analytics. Besides that, the team also managed Malaysia's COVID-19 data repository via GitHub and translating those data for public viewing via COVID Now. Passion in preventive medicine drove him to venture into a healthcare revolution where digital transformation, AI, and Internet of Things were utilized to modernize healthcare. Dr. Mahesh strongly believes that information technology, big data, and professional healthcare are paramount in ensuring a healthy, disease-free community, focusing mainly on preventive medicine. Welcome, Dr. Mahesh. And my third panelist is Dr. Firdaus. So basically, Dr. Firdaus is an oral and maxillofacial surgeon who is currently the CEO of Benchmark Biomedical Supplies in Berhad, as well as the principal oral surgeon at both Avicenna Specialist Hospital in Shah Alam and the Klinik Pergigian Firdaus Dental Group. He is also a council member of the Malaysian Dental Council and deputy president of the Malaysian Orthodontics Practitioners Association. Currently, he is very much committed and involved in digital dentistry and development of the invisible braces with his homegrown 3D printed digital teeth aligners technology known as Orion Aligners Orthodontic System. He travels the world attending international conferences, namely Italy, US, as well as Singapore, where he lectures extensively on the advantages of digital dentistry over the traditional time-honored stone-based dentistry. By the way, my wife is one of your students, Dr. Firdaus. Yeah. So our third speaker here is, he flew all the way from Singapore, but he's a Malaysian, is Leon Jackson, who is also a software engineer for the past 21 years and had the privilege of being a CIO of a healthcare provider, a CTO of an EMR company, and the healthcare chief technologist for Amazon Web Services Asia Pac. He is an entrepreneur who has built and sold off 3 companies in the past and is now working with Roche, a digital solution unit for Asia Pac as well. Let's give a round of applause to our panelists here today. So, Dr. Mahesh, Lee Jin, Dr. Firdaus, Leon, I'll start by saying that basically digital economy has contributed approximately about 22.6% to our GDP. And there's various opinion and I would say sentiments about digital health or health tech. Some says that we are lagging behind fintech, retail, supply chain, agri-tech, insurtech. And some people say we are at par. So maybe before we start discussing about all this, maybe Leon, if you could give us some overview about what is digital health all about.
Sure. There are typically 3 stages that a country goes through or a healthcare system goes through, right? Sorry. And that is, digitization of healthcare information, and then the digitalization where that is then made interoperable between different healthcare services. And then finally, digital transformation, where you could actually reimagine or reinvent the way healthcare is delivered, whether it's moving towards wellness or enabling telecare, teleconsultations and things like that, right? So a lot of this depends on that infrastructure that needs to be put in place. So most of the time when people speak of digital health, it's essentially that process of getting to a place where we can reimagine the way we deliver healthcare.
Thanks, Leon. So now moving forward, for our panelists here, so what could be the most important verticals in order for us to drive digital health in Malaysia? So, there are various opinions. Some might say that it is digital infrastructure. Some people might say it's regulatory. Some people might say it's policy. Some people might say it's legal. Some people might say it's data sharing policy. So maybe, Lee Jin, do you want to start?
Thank you. I would say everything that you've mentioned applies, but above it all, I think it starts with integrity. Because the way in which digitization and the computers and the internet works, it is very much out there and it is out of control. So if it doesn't start at a place where there is integrity and where there is no trust, I think we will forever have issues with regards to how we can move forward digital health. Like for example, I seriously love my Sejahtera, how it has moved perceptions of people that we can actually make this work and we can actually track people's movement and people's lifestyle and their health choices, etc. But now, because of all the not so savory the issues behind that, so people have lost trust. And I think I'm one of the few people who's still using my Sejahtera. I just updated my organ donation via that, you see. So if it doesn't have integrity and if it's not based on trust, I think we'll not get very far.
Yeah, maybe Mahesh, you want to jump in there? I'm trying to stir something here, but I'm trying my best still. So just feel free to jump in and you can yeah. So what do you think, Mahesh, about what Lee Jin just said?
Thank you.
Sorry, I had to poke at you, huh?
No worries. It's a free country. You can say whatever you want to say. So I think I concur with what Ms. Lee Jin just said. Digital trust is really, really important. And currently, without any policies and regulations in place, or I would say not updated, it's difficult. See, like what Ms. Lee Jin said, of whatever is going on, right? There's probably little evidence to say that there's no evidence to say data has leaked and whatnot. With social media, you have a lot of things going on, right? So how do we manage perception? Okay, it's a difficult task, and MOH has taken a very bold step ahead. Number one, if it was compromised, we wouldn't have still continued using it, right? So now with it being transitioned from a COVID app to a public health app, we know that all of you can be rest assured that nothing has been compromised. But again, we have to be always on our toes, right? We need to make sure that we have got regulations in place. I think that's very, very important. Right now, we only have our Telemedicine Act 1997, which does not really cover a lot on digital health, right? So we need an updated regulation policies available. And lots more to talk about. I think I'll let the other speakers to continue first. Thank you.
Yeah, so Leon, you want to jump in?
Yeah, I concur that the integrity and trust is very important. And, you know, the way to think about it is, you know, if a bicycle amplifies the human being, you know, a lot of what we do in digital is that amplification of what's going on in healthcare. And so then the crime follows and everything else. And I think we've been through a lot in Malaysia, you know, our IC numbers and phone numbers published on Lawyat and things like that, right? So wherever the blame lies, I think bottom line there is a task, you know, in parallel to accelerating a lot of what we're doing, is putting those brakes that work on the bicycle and having everybody trust that when they press those brakes, they can stop, right? I think it goes parallel with all the transformation that we want to do.
Thanks. Dr. Firdaus, do you want to add?
Yeah, I'd like to add a little bit on this vertical migration. What is preventing more digitization within our medical fraternity? I, as a practicing doctor, I see patients every day. And I'm older than, I think, some of you, probably all of you, okay? So I started having a mobile phone when I was 31 years old, okay? So that's how old I am. So in a sense, we doctors, we were trained in the analog fashion. So therefore, to absorb all these digitalization is still a big problem for us. And the trust in terms of data, in terms of loss of data. We had data theft many years ago when we started digitization in our practice, and we have made some safety allowances and things like that. You know, it rocks the foundation of your trust when you have this sort of problem. But today, I think with blockchain coming up, I reckon that we can have a better trust, and also the ease of use of digitization, especially with us doctors. We are hands-on, we are wet surgeons, as we say. We use our fingers more than anything else. We like to use our pen. We talk about sterilization. Therefore, a lot of these adaptation needs to be looked into before we can totally say that we have digitized the practice. Thank you.
So thanks, Dr. Firdaus. So now this leads me to my second question. So where do you all think Malaysia is when you talk about digital health? Because, I mean, from our white paper that we just recently released together with Huawei, you can see that the top 10 growth we see in sectors, agriculture, media, manufacturing, finance, real estate, energy, corporate, and there you come healthcare, right? So in terms of average broadband speed is 44. What do you call this? EWR number. Let me just pull out this information. So basically, it's 40.13 Mbps, which is number 38 in the world. So, I mean, is this a precursor, or is this something that needs to be addressed in order for us to accelerate digital health in this country? Or is it solely because of poor investment? Or is it solely because of technological capabilities? Or is it because of talents? So maybe we will start with where are we as compared to other neighboring countries in ASEAN, and then probably after that we can deep dive into what are probably the contributing factor for deceleration or acceleration here. So maybe we'll start with Leon.
Yeah, I think if we talk about trends of our neighbors, and we are part of a very developing part of the region, right? And so we have some very highly developed neighbors like Japan and Korea and Singapore and Australia. And when it comes to digital health, and then we have the rest of the region that is also now putting that infrastructure in place. I think one trend is in ASEAN we see that internet penetration, the use of mobile apps, these factors are quite high. So there is a sort of grassroots adoption of tech that has always been there. What we are struggling with now is connecting that back to the establishment, back to the infrastructure, right? And so a lot of the examples from COVID is when, these e-government services were designed around to help and track and trace and guide people. I think these are just examples of how that could look like, right? And that's a lot of the conversation that we're having, is how do we then connect back that citizen, and no doubt we still have to do a lot of work in terms of internet speeds and other things like that, but how do we then connect back the citizen's interest to the establishment that exists?
Yeah, Dr. Mahesh, do you want to add?
Right. I love this quote by Sir Albert Einstein. In the midst of every crisis lies great opportunity. And this pandemic, COVID-19 pandemic, accelerated the digital tech industry. Not only the government digital health sphere, but also the private players as well. And all of you can agree with me that this is one of the most data and digital intensive pandemic management ever in history. So if you look at it, I think where Malaysia is now, we have bits and pieces of everything, which I think could be a catalyst for even more further development in digital health. Like what we see here, like what I said, we have already transitioned MySejahtera to a public health app. The most difficult thing to do is to onboard users and to acquire users, to onboard facilities. We already have about 30 over million users, and the number is growing, right? So we have that catalyst already. But we still lack one thing, okay, on basic information from hospitals and clinics. So probably now we do have a lot of digital drivers, enablers within Ministry of Health Malaysia and within the government service. We have to digitalize the healthcare system, not speaking only for the in the government sector, but also the private sector. How do we share data and whatnot? So where we are now, I'm not sure how we are as compared to Singapore. I know all of you know the answer, but we are accelerating. We will reach there now soon. Thank you.
Thanks, Dr. Mahesh. Lijin, would you like to add something?
Actually, the way I look at it, as to answering your question directly, if you're asking that, are we there yet? I would say that our infrastructure is not there. And where medical services are concerned, I'm sorry, there's no room for error. Don't you think so? I mean, you can play a fool, you can experiment with any other sector. But if you're going to talk about medical sector, you're going to talk about pharmaceuticals, there is no room for error. And until and unless the infrastructure is ready, then I will say that we are ready to push health tech forward. But the way I look at it, I think health tech...
Mahesh, you can always jump in.
Yeah, jump in, yes.
Jump in, she's waiting for you.
After Legion. Yeah.
No, seriously, because I feel that, if we don't have the infrastructure in place and we start making these changes and suddenly there are errors or there are, blackouts or whatever, what's going to happen? The guy is in the middle of a procedure or whatever, right? So we cannot afford those errors. What do you think?
Yeah, I agree with you. But you see, we always look at problems.
Not problem, hurdle.
Okay, let me say challenges. I always like the 80-20 rule. In life, we always look at the 20% of the things that we have in front of you. That's already a black curtain. That is why we never progress. In these 2 years, if we would have thought in MOH, okay, if we always think that, oh my God, my KKs, my health clinics doesn't have enough computers and whatnot, we would not have achieved whatever we have achieved today. Again, we need that spur of the moment, and we have to focus on that 80% benefit that it can give us.
That's what the pandemic did. You see, that's why I felt that the pandemic really broke all the rules that we have in place, because at that point in time, when you want to balance the risks and the benefits, then I would say that, what's the risk of just taking the risk and to proceed with whatever, because otherwise you will all die from COVID. So,
Remember that we had the MySejahtera, Just recently, when I went to the United States, there's no such thing. So that's the thing, we have done something that even the developed country has not done. They are non-standardized. They are MySejahtera. I went to NYU a couple of months ago, and they had their own microcosm. That means that they have their own MySejahtera. The next building has its own MySejahtera. So they were in real, chaos. Their health system is in chaos because, why? Because they were on an established line. Their capability in terms of the internet connectivity, yes, of course, it's high, but a lot of it is on fiber optics, on the on copper. But most of us had come into a new paradigm where we went wireless. So we had, and the other thing is we were very quite centralized. As in America, they did not have a Ministry of Health as such, and therefore, everybody had this different policy. And I think, I'm proud to looking at our death rate is so low compared to established countries like Italy, like in America. So, sometimes you have to do some harping on your own and see how we have progressed in the world.
I totally agree, but then again, I'd just like to remind you guys what happened as soon as the controversial came out, you see, and everybody stopped using MySejahtera overnight. I thought that was so painful. Even today, I feel that it's a shame.
Let me bring you all back towards the topic. So it's digital health. So we are looking at various ecosystem here, right? We are not focusing on MySejahtera alone. So what I'm trying to say is how do we accelerate digital health? And I think, Legion, your point is infrastructure. Infrastructure needs to be done. So Dr. Mahesh, what do you think is the main key point for us to accelerate? Is it going to be investment, or is it more investment to Malaysia, or is it regulatory?
Yeah, I think first would be change.
Change.
We need to start having digital
Mindset,
minds.
maybe.
Yes.
Yes.
We need to start having digital minds, right? Otherwise, we will not go so far, right? That's one thing. And again, regulation and policy. Once we regulate, then I think...
and I think that will be a big support, because if it's not regulated, then people don't know how to start, when to start, and all that, right? You're right, you're right.
I think it may also come back to this idea of trust and communication with the citizens of Malaysia, right? And if you think about it, maybe, if people understood why telehealth is important, and how, they could be, there's, the benefits of remote patient monitoring, or the benefits of taking away that barrier of getting a consultation when you're worried compared to that time that you need to get to a clinic, and if it's integrated to your healthcare. If people understood that, then the risk of technology would be more palatable, right? Because if you think about it, even in Singapore there was a healthcare hack, many years ago, right? And it didn't stop them from progressing into giving everybody access to a personal health record and things like that. And if you think about it, we deal with air crashes all the time. We just adapt and de-risk every flight after that, right? So this digital question, it's a question of just managing that risk. Yeah. But I think what we really need to do, it's a real issue of trust in this country after the few incidences that happened. And I think MySejahtera is just getting the avalanche of previous issues that have happened, to be fair. Right? And so I think it's all about building that trust back now.
Great. So maybe Dr. Firdaus, from applications, we can go dive a little bit on virtual surgeries, robotics in dentistry. So maybe you could share some new developments for us.
Thank you so much. We took an initiative under both Vicina Group and also our Benchmark Biomedical. We went into 3D printing way back in 2017. In fact, it went way back when I was in University of Malaya, back in 2004. The catalyst was the automotive industry, actually. I talked to the Vice President just now. In fact, it is sometimes medical industry will get something that comes out of sophisticated design from the industrial side. One of my experience was Proton was collaborating with a company called Materialize in Belgium to develop their Proton cars, and they had an offshoot wing called Mimics, and also materialize implant design. Okay, so what they did was they then put the branch of their medical device in Malaysia to basically service Japan, not for Malaysia. But what we had was a very sophisticated 3D printing technology that we use. So I was very fortunate in 2004 to actually produce the first surgical guide for both the jaw surgery and also placement of implant. And this came from Belgium, indirectly through the automotive industry. So this is the follow-on that I would like to have, in future, if you can synergize between many industries, and we get a lot of these benefits. The second thing is that with that, today we have developed through our company called Dentadrone. So now we do a lot of millings of crowns. We do invisible aligners. If you heard of Invisalign, yeah. So we have Invisalign in Malaysia. That means that we develop, modify some of the basic software. We, in fact, modified software like Blender. You can download Blender for free. So we've developed, adds on to Blender, which we will then develop into aligner softwares. And we can do that. And we can make the software to a point where it is 1/5 in terms of price, in terms of manufacturing, as compared to something that comes from America. Yeah. So this is something that we've done so well in the last year or so.
Thank you, Dr. Firdaus. Thank you. So are we open our questions to the floor, Mr. Chairman? Because I think there was supposed to be a list of questions, since we have about 4 to 5 minutes more.
Excellent. We've got our assistant here.
Yeah.
Very handsome and charming, just like you.
Thank you very much. Okay, 10 minutes though, that's good. So, question for Dr. Mahesh. We have here. I don't think she'll sound like Lee Jin, but it's from the crowd. No, Lee Jin, just kidding, like Lee Jin. Questions for Dr. Mahesh and all panels mainly. How can MOH assist AI development in healthcare sector to allow data analysis without breaching PDPA? So that's the first question, Dr. Mahesh. Okay, maybe yeah. We'll kickstart with the first question first, and all panelists too. You can jump in anytime. Yeah.
So when we talk about AI, where we are now, again, right, we don't have the basics within MOH as yet. So we hope to have, make all our facilities electronic. When you talk about AI, the first few things that we did also during the pandemic was how we digitally contact trace people, right? We put in intelligent algorithms. We traced close to about 47 million casual contacts, right? I'm sure most of you have gotten an annoying text or message you've been, and at the height of the pandemic, the positivity rate was close to about 60%, right? So that's one thing really good. Okay, so now where do we, on data, okay, MOH is not, we are not governed by PDPA 2010, okay, because it's a government agency. Of course, right now, amongst all the agencies, one particular agency who's very stingy about data, that's us in MOH. Because all of us are doctors. When we took our oath, when we started work, we'll be like, patient privacy, confidentiality. We do not share data. But we've started doing it now. We've started doing it now. We've made a lot of our data public right now. We've got COVID now has already converted to become KKM now. You can see a lot of our hospital data out. Sharing with the private sector. We are actually planning for some sort of an ecosystem where, because I'm a strong advocate on a public-private partnership. We'll never forget our digital players during the pandemic. And that has actually opened all our eyes. I see some of them here. We won the private guys together with us, and that's where Ministry of Health is heading to. And of course, not governed by PDPA, but again, there would be laws coming up, and we would definitely welcome. And this has to go two ways, right? The private data and the government data how we link it together and how we can do wonders together. And with one thing, making sure that privacy and confidentiality is always maintained. Thank you.
I would add to that, number one is I think we have to work with some of the big global AI leaders and learn from them, import in some of that talent and capabilities. And then the second thing is that it is now possible to do a lot of privacy preserving engineering, everything from tokenization to homomorphic encryption. There are technical methods and mechanisms today to do this kind of research in trusted research environments. And you can see examples of that with the UK Biobank and things like that, right? So it's technically now possible.
Can I just add a little
Yes,
bit on what
Legion.
we are doing in partnership with the Ministry of Health as well. So where the Pharmaceutical Association is concerned, what we are doing is that we're working very closely with the Ministry of Health in order to have a track and trace system in place for where the medications are. So recently there was this issue of having medicine shortages. So we were having to get my members to report on where the medicine is and what is the medicine that is currently available and what is the shortage like. So with
I
the
have
track
a
and
lot
trace,
of problem with that.
yeah, once the track and trace service
yes, good.
is in place, which we are currently trying to work with the Ministry of Health, all these issues will go away because you'll be able to track the journey of that medicine. So we know where it is. Is it at a warehouse? Is it at a hospital? Has it arrived at the patient's hands? And another innovation that is being worked on at the moment in collaboration also with the Ministry of Health is the e-labeling. So you see inside every box that you have this little piece of paper inside, right, that has got all we call it a paper insert. So every medication has that, to let you know what are the contraindications and this medication is safe for certain people, not safe for certain people. So under the e-labeling system that we are currently assisting with the Ministry of Health, you will not have that piece of paper anymore. You will have it as a QR code on the box. So this is actually very important because it really helps with the safety elements. Every time you have a paper insert, it could be outdated because we update the safety information, the safety profiles of every drug every few months. But your paper insert could be produced maybe 2 years ago. So with the e-labeling in place, the safety is going to be enhanced and every information that you can find is going to be real-time. Exactly real time. So that's something which we are collaborating with.
Thank you, Legion.
Can I go just one?
Yes, sure.
The other thing is that about regulation. If we can make sure that we have a balance, under regulation is dangerous for the public. Over regulation will also be a problem. I find that a lot of our problem with say registration of medical devices. So you see that you go and look at China and Japan. These are the most tight medical regulation. We don't want to go there because that will only stop innovation. I know a lot of our new material, a lot of our new equipment, I can find in Malaysia, but the Japanese doctors cannot get because they need another 4 to 5 years before the testing. So if we can, Malaysia, please don't over-regulate and don't under-regulate as well. Thank you.
The person is just next to you, Dr. Firdaus. So anyway, I think before we wrap up, I think we have about a couple of minutes more. So now I just want to ask all our panelists here, just imagine you are let's say the health minister tomorrow, or you are the prime minister, or you're the director general of health. What one thing will you do differently in order to accelerate digital health in this country? So we'll start with Legion.
Actually, if you just ask for one thing, that's the tough part. You see, I've got a whole list of them. But, I think...
You only got 5 years, so you got to think of one thing you're going to do.
You're right. Yeah. So I think where the regulations are concerned, and I totally agree with Dr. Firdaus, what we need is a paradigm shift. We need people to accept that this is the way forward. And for somebody who is who's moving towards the aging society right now, you must remember that the people who are using healthcare services today, as they are aging, are not that savvy. So you have to make it friendly enough. So the regulatories have to be loose enough so that you can encourage digitization, but they have to be strict enough that we do not compromise on the safety and data security, etc.
So, Legion, you're saying that you will be working on regulatory frameworks, those
Yes,
kind of
that's
things.
right, that's right.
Okay, thanks, Legion. Dr. Mahesh?
I would probably democratize healthcare service. I would get, of course, there's no point of us reinventing the wheel. There's a lot of products out there which is good. There's a lot of private players out there which is already doing stuff that we need to do. Back to basics, collaborate, and I think we'll win.
So basically, your point, Mahesh, is don't reinvent the wheel. It's public-private partnership, collaborate, right? Fantastic. Okay, Dr. Firdaus.
Election is near, so please vote for me. No, I'd rather not be Prime Minister. I'd rather be Minister of Finance. That would be very nice. So for me, I think we need to encourage more medical patroneur. I don't know what you call it. We call it dentalpreneur or medical patroneur. So we want to get medical sector to have better infrastructure, better taxation for upstart. That means that I know there's all the MSc status, but make it more transparent so people can come and bring their good ideas. As you know, most of the best ideas are actually developed at the back of the clinic somewhere in a laboratory, a small laboratory. All the great invention in the world comes out like that. So hopefully the government will give better tax breaks for these smaller companies.
So if you're the minister and all that, or the DG, you're going to look into tax bracket to drive digital innovation. Okay,
Absolutely.
fantastic. So you guys can vote. We have 3 candidates now. This is our 4th candidate. Yeah, Mr. Leon, how will you do it differently?
I think I would go for a moonshot that I can mobilize the country around, something that improves access to care, something that improves the patient experience, right? And while doing that, kind of builds this infrastructure for doing more, and also enables a lot of these private-public partnerships.
Great, thanks, Leon. So I think, and in a nutshell, I'll just wrap up. So I think right from the early part of the discussion till what we are discussing now, I think the biggest challenge here is we still have this issue of data sharing, trust, transparency, integrity. So I think, honestly, for me, after listening to the panelists, I think what's important here is, in order for us to drive digital health, I think it's important to have an ecosystem where every organization, whether they are government, academia, non-government, to be part of the life cycle of this data. So when you're part of the life cycle, I think everyone tends to contribute, and not just by a top-down approach, but it's going to be something like a top-down plus bottom-up. That's number 1. Number 2, I also feel that familiarity is very important. So digital literacy in healthcare, about digital health, about data sharing is important, because familiarity will drive maturity later. So if we don't have familiarity, that's when, like what Mahesh said, people look at the 20% or problem or 30% of the problem. And finally, I believe that if you want to have something you never had, you got to do something you have never done or you've never did. So I think that concludes our session for today. Thank you very much to our dear panelists.
And thank you very much to our moderator as well, ladies and gentlemen. That was Dr. Dhesi Baha, Board of Director for MDEC. So thank you very much, our panel. I must say there are quite a few takeaways right here. So, of course, Dr. Mahesh has stated that the pandemic has accelerated the adoption of digital tech in the healthcare industry. And so the conversation turned to processes, or more focusing on processes versus a shotgun approach to technology. It doesn't make sense to spend a lot of money on all this tech and you don't know how to use it in the most efficient way. Now, the ASEAN trend for digital health infrastructure is also an uptrend. I don't know whether it was mentioned earlier, but I wanted to mention in 2021, Thailand launched their first and largest 5G hospital. So that's the benchmark that I think the rest of the region would like to follow. Madam Chan Lee Jin did mention that in healthcare, there is no room for error. I like that bit as well. So unless the infrastructure is ready, lives are at stake. And so maybe some of the suggestions, in case any of them become Director General of Health, I love their suggestions, but I would like to suggest a national digital health sandbox as well, for digital players to come together in a controlled environment to test out transparency, to test out security of data as well as integrity. And so, ladies and gentlemen, if you do have any feedback for this particular session, can we please have the QR code up, please?